Hello. In this video, you will learn how to properly use a TrueNat TB test kit. The following are easy instructions to follow whether you are in a laboratory environment or in a field scenario. Before anything else, wear proper personal protective equipment or PPE such as a gown, mask, hair cover, and gloves. Apply 10% bleach solution to disinfect the work area. Let it stand for 15 minutes before wiping it off with 70% alcohol twice. Place a clean absorbent material such as a laboratory mat or tissue sheets on the specimen processing area. Set up the workspace. Ensure that before starting specimen processing, all materials needed are complete and all equipment are functioning and fully charged. Place the equipment on a flat and steady surface away from direct heat, sunlight, and vibration-causing instruments. This is the TruePrep Auto V2 device. Ensure that the TruePrep Auto MTB sample pre-treatment pack is plugged to the backside of the TruePrep Auto V2 device before starting the test. This is the TrueLab Duo PCR analyzer. Turn on the machine by pressing the power button at the backside panel for 2 to 3 seconds. Label the sputum cup legibly with the client's complete name and date of specimen collection. Give the sputum cup and water for gargling to the client. Make the client gargle and rinse thoroughly with clean water. Instruct the client to take 3 deep breaths. Make the client hawk the phlegm from the deepest part of his or her lungs and spit it out. Collect 2 to 5 mm of sputum from the test subject. Check for specimen quality and quantity upon receipt. Label the lysis buffer bottle legibly with the client's name and client or specimen ID. Add 2 drops of liquefaction buffer to the sputum cup without the liquefaction buffer's nozzle touching the specimen container. Cap the sputum cup. Swirl it gently to mix and liquefy the sample. Incubate the specimen for 10 minutes at room temperature. If the specimen is not yet at the consistency to be loaded into a pipette, let it sit for another 5 minutes while swirling at 2-minute intervals. When it has achieved the correct consistency, use a 1 ml transfer pipette to transfer 0.5 ml of the liquefied sputum sample into a lysis buffer bottle. Then, add 2 drops of liquefaction buffer to the sample in the lysis bottle without the nozzle touching the lysis buffer bottle. Gently swirl to mix. And allow it to incubate for 3 to 5 minutes. Open a cartridge pouch and take out the cartridge. Label the cartridge and place it on the cartridge stand. Take out and set aside the elute collection tube label, the elute transfer pipette, and the elute collection tube for later use. Label the ECT accordingly. Open the sample chamber of the cartridge and the lysis buffer bottle. Use the 3 ml pipette to transfer all the contents of the lysis buffer bottle into the sample chamber. Discard the lysis buffer bottle and transfer pipette, and close the sample chamber of the cartridge. Load the cartridge inside the TruePrep device. Press the On button to activate the TruePrep Auto V2 device. Power LED will blink red. Then, press the Eject button to open the cartridge case. Slowly pull out the cartridge holder. Place the cartridge in the open cartridge tray. Then, gently push it back in to close the cartridge holder. Now, press the Start button. After pressing the Start button, the DNA extraction process will take about 20 minutes. At the end of the process, there will be a loud beep from the device. The cartridge holder will pop open automatically. Slowly pull out the cartridge holder. Remove the cartridge from the TruePrep Auto V2 device. Place the cartridge in a cartridge stand and close the device. Using the elute transfer pipette that you set aside a while ago, gently pierce a hole in the elute chamber. Then, transfer the entire elute into the elute collection tube. Throw away the used pipette and cartridge. Enter your login details in the TrueLab Duo PCR Analyzer. Before entering the client details, select the test profile to run, which is either MTB or MTB+. Press Start Test. The chip tray will automatically eject. Open a pouch of the TrueNat MTB chip-based micro PCR test and extract the chip. Pull out the chip from the sleeve by holding the edges. Gently place the chip on the tray by aligning it in the slot provided without touching the white specimen well. Open the master mix tube. Discard the stopper. Place the master mix tube in the microtube stand. Attach the pipette tip to the single push pipette. Transfer 6 microliters of the elute from the ECT into the master mix tube. Allow the master mix to stand for 30 seconds to get a clear solution. After 30 seconds, using the same pipette tip, transfer the elute from the master mix tube to the white reaction well of the chip. Discard the micro tip using the auto ejector in the pipette. Click Yes on the device screen to start the test. The real-time amplification curve and run status can be viewed during the test by clicking Optical on the screen. After 35 minutes, the device will make a beeping sound to signify that the PCR reaction has been completed. Once the reaction is complete, the report can be viewed directly from the main screen. If MTB is detected in the sample, run rifampicin resistance testing using the same DNA elute. Select MTB-RIF in the client's results screen. Repeat steps for PCR-TB process using a new TrueNat MTB-RIF diagnosis chip. Rifampicin resistance testing will take an additional 60 minutes. After specimen processing, discard all used materials and PPEs accordingly and perform hand washing. When followed carefully, these simple instructions will allow you to properly and effectively use the TrueNat TB test device, whether in a laboratory or out in the field.